We now move on to session 2, towards zero, from regulation to innovation. This session commences with our colleagues from Western Australia, who have been leading the way with relational feedback in Australia since 2016. And we are fortunate to have an all-star lineup to speak to the vision for the consumer voice in WA, Western Australia. I will now introduce all of the speakers together so that I don't interrupt their presentation. First up, we will be hearing from Frances Downey, who is the current Director for Health Networks within Clinical Excellence Division at the Department of Health WA, having only recently joined after working in a variety of senior health services improvement roles since 2006. And as a former nurse, midwife, and social worker, Fran is passionate about new and innovative ways to optimise patient experience and support truly person-centred care, as well as supporting clinicians to deliver equitable, accessible, and supportive healthcare. Fran will be providing us with a background of how Care Opinion came to be working in every public hospital in Western Australia, and how this is looking post-COVID. And you will hear throughout our program that in aspiring for a safer and happier experience of healthcare, the experience of staff must also matter. And it'll be really good to hear from that. I also have the great pleasure of introducing our second presenter from the WA team, Dr. Tina Bertilone. Tina is the current Executive Director for Patient Experience and Clinical Excellence at the North Metropolitan Health Service, having joined recently after 8 years working in safety and quality in the Department of Health, and as a former GP and now public health physician with a subspecialty interest in patient safety and quality improvement. She is passionate about new and innovative ways to optimise patient experience and support person-centred care, as well as supporting clinicians in clinical outcomes measurement, quality improvement, and other methods that support the culture for clinical excellence. Tina will be providing the Western Australian Health Service and clinician safety and quality perspective in her presentation today. And we cannot have a conversation about the consumer voice without a consumer voice within WA. And I also welcome the Executive Director of Health Consumers Council, Clare Mullen, who will also join the WA team in the presentation this afternoon. Clare has a background in change management and communication in health and community sector in the UK and in Australia. Familiar with workings in WA Health through various roles with health networks and the safety and quality teams. She brings her passion to every interaction and is dedicated in creating opportunities for people who use the health system to be part of shaping it and to improve health outcomes for all. Clare will provide us with a vision of for consumers as partners in safety in WA. Please welcome the team from WA.
Thanks so much, Tina. Hi, everyone. I'm Fran Downey, as Tina introduced. Can we move on to the next slide, please? So, as Tina mentioned, I'll be presenting from the Department of Health perspective. Clare will be from the Health Consumers Council, and Tina will be from the North Metropolitan Health Service, which is one of our health service providers. Okay, next slide, please. Before I begin, though, I'd like to acknowledge and pay my respects to the Noongar Whadjuk people upon whose land I'm meeting with you today, and pay my respects to their elders past, present and emerging. I also want to recognise the significant importance of their cultural heritage, values, beliefs and self-determination in contributing to the positive health and well-being of our community. I also extend my respects to those that are Aboriginal and Torres Strait Islanders present today in this conference. And also just like to let us acknowledge that we celebrate their culture every day, and note how privileged we are to share this country. Thank you. So as Tina mentioned, I'll be presenting on background and context. Then we'll have Tina presenting from a health service provider perspective, safety and quality context, and then we'll have Clare looking at the strategic vision for consumer collaboration in WA. So just to give you a bit of background, so this just shows the public health system. I'm in the Department of Health, which is considered a system manager, and underneath that, sitting in this structure, is 7 health service providers. As mentioned, Tina is in the North Metropolitan Health Service that you'll see there as the first health service provider listed. But this doesn't represent the private health sector, nor does it represent the community health sector or peak bodies such as the very valuable Health Consumers Council, where Clare will be speaking from that perspective today. Okay, next slide. So just to give you a bit of a background to the journey so far in WA, in 2017, Care Opinion was endorsed as a state tool to support patient experience. It was a state government election, and that was based on the findings of a pilot that was in 3 country areas or rural areas in the Kimberley region, Midwest and Great Southern region across WA. In July 17, so 6 months on from the initial election commitment, all health service providers became subscribers to Care Opinion and began responding to stories about their services. And then from 2019, all Care Opinion reports were publicly released so that it was publicly available on a quarterly basis across the system. Click next. And then we can go next slide. Thank you, Alicia. So just to give you a bit of a snapshot of the last full quarter that was reported, across WA, there were 359 stories published. There's over 1,300 staff that are prescribed currently to Care Opinion. The response rate to those stories was quite high at 98, nearly 99%. And you'll note there that the number of stories leading to change doesn't seem that much at first glance, but that's to pay note to a lot of the stories, as James and Fraser mentioned earlier. Overwhelmingly, we get a lot of positive stories in WA. Also, some of them are behavioural changes in terms of staff behaviour that aren't actually captured here, because how the change is sort of captured is based on process changes across the system. So it doesn't really reflect the effect that Care Opinion has on our system. Next. So in terms overall, over the last quarter, the positive experiences overwhelmingly are around caring staff. There is a bit of a double up here. So you'll see that nursing care, there's midwife repeated a couple of times, medical care, staff care. So overall, person-centred care and caring staff are greatly respected and fed back to clinicians. Next slide, please. In terms of getting feedback from the health service providers, on the whole, the health service providers have said what's really valuable about Care Opinion is to get the patient journey in the words of the consumer. It also provides a true sense of emotion and feelings related to those experiences that they may not capture via other mechanisms. It's really good morale boost for staff, as mentioned in the other presentations earlier, for staff to get that feedback. And the stories arrive in near real time, as opposed to other feedback processes that currently occur. The board members and executives across the health service providers subscribe and review stories as case studies in their executive meetings and look out for what's working well and what presents improvement opportunities for change. It's a very easy system to use and it's publicly visible. And there is some level of control. The staff do like that they are able to moderate some staff responses where staff may get a little bit defensive in relation to feedback. So in terms of what consumers have generally said as improvement areas is communication comes out loud and clear. That's repeated a few times here. And also some of the staff attitudes and behaviours are the main things that come out. In terms of the hospitals, the feedback around what their main challenges and opportunities are. So one of the big challenges they're currently facing is that consumer stories are de-identified. And so when they need to respond to a consumer, they feel that their responses often seem quite tokenistic, as they can only encourage consumers to then provide additional detail that would allow them to follow up in more granularity. But this doesn't often occur. And also, while it's great to have individual stories, it can be a bit difficult to identify systemic trends and issues across the system. It's also quite difficult to respond if consumers come in and raise inaccurate information in stories, because they feel that if they go back and try to counteract that, it can seem quite defensive. In terms of opportunities, the hospitals are very keen to increase uptake of care opinion and try to promote it as much as they can without additional burden on staff that are already feeling quite stretched. It would also be good to link existing feedback for trend analysis with reporting dashboard enhancements, which we're looking at currently in WA. And also, it would be good to present other options for those consumers that have limited English proficiency and other populations at risk of lower health literacy. And also, there's a focus on trying to provide training assistance for staff about how to respond appropriately, so that responses can be devolved down to the individual staff member and they don't need to be moderated. So overall, over the last quarter, the resounding feedback has been that consumers in WA across the health system have been very thankful. They felt supported and cared for. Again, there's a double up in the wordle here of how the stories are tagged. So overwhelmingly, the response have been positive from consumers, which is great. And now I'll hand over to Tina. Thank you.
Thanks, Fran.
Thank you very much, Fran. So as mentioned, my name is Tina Bertilone. I'm the Executive Director for Consumer Experience and Clinical Excellence in North Metropolitan Health Service. We just move on to the next slide. So I was conscious there's people on the call from all over the world, which is awesome, and you might not all realise where we are. So Western Australia, it's a really big state. Tried to map out on this map where our health service sits geographically. You can't even see it because our country areas are actually so big. So we just click through, we'll see where we're situated in metropolitan Perth. So we have a river that runs in the middle of the city and we're in the north, which of course makes sense. Our population covers just over a quarter of WA's total. So a big service that includes one of our 3 big tertiary centres in Metro Perth, a specialist women's hospital, specialist mental health services, dental, and a couple of others. So quite a big service. So we move on to the next slide. So I just wanted to share this article, which is one that I really love, that was published a year or 2 back, which was around the different stages of safety and quality in healthcare, and kind of really links in with consumer engagement, co-production, use of care opinion, and other tools around consumer experience. So it all started with Quality 1.0, which is very much around thresholds, accreditation, standards, and wanting healthcare to ideally follow certain processes and pathways. Then we moved sort of through to Quality 2.0, which was a value add to 1.0, and was really about processes, quality improvement, safety and quality indicators. And then the new movement that we're sort of starting to see really now is around Quality 3.0, which is very much around co-production and looking at healthcare as a service rather than as a sort of a product logic. And that's really about people working together, and they talk about kinship and very much just about consumers and staff sort of looking out for each other within a health service, which I think is a really nice and really simple idea of thinking about quality. So here at North Metro, we've been trying to think about how consumer engagement, co-design and co-production fits in throughout the service in all these different aspects. So the first one is really around strategy. And so that includes things like partnership frameworks. So at North, we've got a partnership model that will be shortly launching publicly early next month, which is awesome, and is really just the first step in our journey towards greater consumer engagement and co-design within our service. Then the next step is really around governance. So looking at having consumer representation on our board, our executive committees, and other relevant committees throughout the service so that we get greater consumer participation. And of course, our community advisory councils and standing those up and getting them really involved in all the different aspects of safety and quality within the service. So I was really struck a couple of months back. I went to the ISQA conference in Seoul, which was all about co-production. And they did a bit of a survey of participants who are sort of from about 80 countries all over the world. And it was quite interesting to see of all those people that had attended that conference, it was 16% of those countries that had consumers currently sitting on their major governing body or their board. So it really just demonstrated that collectively we've got a really long way to go in this space and we're just at the beginning. So then capability is the next step, a very big topic of discussion in S&Q over in WA at the moment. And that's around, firstly, for when we get consumers involved in our health service, making sure that they have the skills and that we train them up and we don't just throw them in the deep end. So things like getting consumers involved on our clinical incident review panels, making sure that we're supporting them and providing them the appropriate training. But then also the capability of the staff working within our health service as well, so that they actually know how to involve consumers in quality improvement and projects and delivering person-centred care. Then the next bit is around data collection and analysis. So Care Opinion is one of the tools that we use along with several others in our health service. So we've also got complaints, compliments and contacts through Datix CFM. And we also collect data using the MySay survey, which is the RPEX tool that many in Australia at least will be familiar with from the Australian Commission for Safety and Quality in Healthcare. And then the final bit, and really the most important in my opinion, because it's where we actually make change in the service, it's all about QI. So how do we loop in this data to actually drive change in the service? And rather than having just lots of dashboards and lots of information and lots of words, and not really knowing what the themes are or what we can do with it, how can we actually drive change in a logical way? So this is just a bit about how things are looking in our service at the moment. So in terms of inputs, all the various methods of data that I've mentioned, as well as strategic priorities coming through from our consumers, CACs, board exec and Care Opinion. And then the big thing here really being about how do we use these outputs to drive QI, which I think is the million-dollar question and is where we're going to see real change. So not just collecting data, but actually using it to drive improvement and at all the different levels. So at the hospital level, at the health service level, and at the individual care level to the teams that are actually delivering the care. So some of the big challenges in this space, I think the biggest one when looking particularly at sort of the organisational level and how we use this data to drive change is how do we extract the themes from the data and how do we look at the trends and how do we triangulate that up and do it in a way that's not super resource intensive. Ideally, we would be mapping a lot of this information into a couple of simple metrics. And I know that there are other places in Australia that have done work in that space and we're looking to do the same. But really about just using that information and driving it and using it for action. So there is a really good article about the use of Care Opinion and natural language processing, which is just on the screen here for anyone that's interested. That was really just about how you can use some of the newer tools in predictive analytics to pull information from qualitative data and sources like Care Opinion, and an area that we're looking at also over here. So just another really important point around use of data more broadly. So in terms of triangulating and remembering that when we see really good high-performing health services, we tend to see really good staff experience, good consumer experience, and good clinical outcomes all coming together. So just the importance of using all of that information and sort of driving change by triangulation. And then finally, just onto the next slide. In terms of the future for North Metro here, we're almost working towards full consumer engagement and participation in some of our key committees, so our exec committees and board, as well as committees on the floor. Then using that to really start to drive many of our sort of business as usual safety and quality activities to include consumers. So lots of the things that we do day to day around safety walkarounds, local QI projects, clinical incident reviews, and getting good consumer participation in all of those different services. Then making sure that we focus on capability as well, so that our training is designed and routinely offered to consumers as well as clinicians. Then the themes and trends, so having ways to regularly pull that information from all the qualitative sources that we have, like care opinion, Datix and other sources, and then having ways so that our CACs can review those regularly, our exec committees can review them regularly, and our clinicians can see them and get their own sort of personalised feedback on the ward. And then finally, and most importantly, QI initiatives, and linking that all in with everything else so that we're tying in the information that we're getting from our consumers and from the service to actually drive QI. Thank you.
Thanks, Tina. Oops,
Thanks, Clare.
sorry.
No, that's all right, Claire, go.
I know we're short of time, and I know that at least two people will be able to understand what I'm saying if I talk really quickly, but I'll just try and talk at a pace which is still comprehensible to anyone who might not be from Scotland. Okay, so Health Consumers Council is an independent charity, non-government organisation established almost 30 years ago to represent or speak up for and be an independent voice for consumers and the community on all aspects of health and healthcare. And I won't go through every word there, but our vision really is of person-centred care, and that is equitable. And we do that in three main ways. And I'll put our websites on the end so you can have a look on that. But I think the main thing I would say with regards to care opinion, I've been there for 5 years. We have had care opinion, as you've just heard, a bit longer than that. And what I know is that the role that former staff at Health Consumers Council really played in advocating really strongly for care opinion to be embedded as a mechanism for providing feedback to health services because of its transparency, because of its ease of use, and because of just the fact that, that openness that people can have a conversation online and see what other people are saying. So next slide. I'm just going to touch briefly on how we see in Western Australia working with consumers, carers, families, people with lived experience and community members is changing. Next slide, please. And this is just a bit of an overview about some of the roles. So generally speaking, I would say that we're moving on from a paradigm which is that bottom right-hand corner. So people as service users, people who've experienced healthcare or have not had the chance to experience healthcare if there's access issues. So in that, like I say, a consultation paradigm, we're going to either ask you what you need from a service or we're going to ask you what you think of a service, and that will be used to improve health services. But what we're really starting to see more, and in fact, just this morning, I had a conversation with some of our consumer leaders across the state and was hearing really encouraging feedback that people are now moving much more into some of those other quadrants. So much more into service improvement, the opportunity to be involved in identifying the need for particular improvement projects, helping to scope those projects and being active partners in the implementation of those projects. As well as we have had consumer perspectives on some of our HSPs, and there's an opportunity for us to keep looking at how we do that. And we're encouraged by the conversations that we're hearing across the state about opportunities for lived experience positions or consumer positions in paid roles at senior levels. And one of the things that I've taken from my experience in the UK was when I worked at the health department in London, and they had a patient and public involvement czar. That was the public name for it. It was a Harry Caton at the time, and his role really was to champion patient and public involvement, as it was called then. We would call it consumer or lived experience involvement at the highest levels of government. And so that's the kind of ambition that we are having conversations about here in Western Australia. What I would say, and to echo what Tina has just said about that question about the training and the capability, what we do know is the need and the opportunity for building capacity amongst community leaders, particularly if you want to make sure that consumer roles are addressing the issue of equity, because understandably, some people, consumers who might come forward to be involved in some of these roles, sometimes do that because they have extra time or surplus capacity. Not always, but sometimes. And so a key thing is making sure that we're being really intentional about reaching out to groups in the community for whom coming forward to be part of, for example, a consumer committee might not be something that they even know is a possibility, and supporting them with training to make sure that they feel confident and capable to speak up and then step into some of these other roles. So I'll move on to the next slide. And I'll just really finish off by saying that providing the feedback is one thing. I think we've heard some great examples from James and Fraser this morning about how people who've been working with Care Opinion platform for a lot longer have really been able to take, and that's a bit of a flippant image on the right hand side, but that consumer input that is shared with the system. But what you need is an equal and opposite willingness to listen and act on that feedback. And I think that that's something that I see consumer reps and consumer leaders being able to really support within the health services, to continue to partner with people who work in health services to take those stories and that feedback and be part of translating that into change. And that's how I think that we will see that transformation. And I say that's what some of the next iteration for Care Opinion that we see here in Western Australia. And I just finished by saying that Care Opinion is listed, we're all working to a really significant blueprint for transformation called the Sustainable Health Review, and expanding Care Opinion is named as one of the objectives under one of the recommendations in that report. So it's really recognised as being a real lever for change. And that is all. Thank you.
Wonderful. Thank you very much to our heroic change agents, our consumer advocates from Western Australia, for sharing your experience and for being long-term partners in this journey with us, and also accompanying the rest of the nation to join the Care Opinion community and to elevate the human experience. We don't have time to take any questions, but we've noted them and we'll come back to them. No question will be left unanswered, and if it's not answered today, it will be answered and distributed.